You're watching Early Identification of the Registrar in Difficulty, produced by GP Supervision Australia and presented by Dr. Simon Morgan. We would like to begin by acknowledging the traditional custodians of the land on which this recording was produced and pay our respects to their elders, past, present, future, and their families.
Thanks for coming along to a topic I think is really important in our role as supervisors, and that's trying to pick up the registrar in difficulty early in the piece. My name's Simon Morgan. I'm joining from a Wabakal country, and I'd like to pay my respects to elders past, present and emerging and their families. And I thought we'd start with a case study, and there's a bit of a cat theme. Let's imagine that we are the supervisor of a registrar called Aisha. Aisha is a GPT-1 and she's joined you in your practice. I've written down rural practice, but it really could be wherever you work. And she's a PGY4 and she's had a nice, good mix of general hospital terms and good references. She really was highly regarded by the references, the referees you spoke with, diligent, polite, dedicated, and you think she's going to settle in. She's clearly quite quiet, but looks like a good GPT-1 registrar. And early on in the first weeks, you're very aware that she is quiet, somewhat withdrawn. She takes a long time with her patients, but so do most GPT-1s, kind of that's okay. She's calling you a lot, and sometimes for clinical queries that you think, well, she seems to know what she's doing, but she's really just seeking reassurance. But, that's what GPT-1s do as well. She's spending a long time writing notes. Her notes are very comprehensive and detailed. And in fact, she's there after hours at times taking notes and composing them. And just towards the end of the first month, you think she's a little bit perhaps short with staff, and she's just a bit sort of, I guess her behaviour's changed a little bit. In the second month, Aisha, there's some issues arising. She is the subject of a couple of just sort of minor patient complaints, people saying, they felt a bit uncomfortable with her. She felt quite unsure and didn't feel like she knew what she was doing. There was again, nothing spectacular, but a bit of a delayed follow-up and chasing down somebody with an iron deficiency, which was just not great. And in fact, one of the receptionists comes up to you and says, look, I think that she might have been in her room crying at the end of a busy day. But what we're going to cover tonight is thinking about, so this webinar is very much around early identification of the registrar in difficulty. We're not going to kind of think about implementing remediation plans and what we can do once we know there's a problem, because of course the problems are multifactorial. But it's really very much about trying to kind of get a sense of what's going on early on so that, we can address issues as soon as we can. So we're talking about screening and assessing registrars in difficulty using appropriate tools and thinking about some supports. So, as I say, lots of cats, but these are my two cats to demonstrate that I do have an affinity and affection for cats. Many people think I should have named these cats Cut and Paste. They are actually sisters, and somebody thought that this was AI generated. They're very rarely in the same screen together, actually, but there you go. They're actually called Lily and Pilly, if anyone's interested, after the tree that was blossoming outside my house when they arrived. And we only had one question from you. How to manage the registrar under remediation. And unfortunately, we're not really going to cover that because that is a kind of quite separate aspect of supervision, and it obviously depends massively on why that registrar is under remediation. So we'll touch on it, but certainly not be addressing it. One of the key themes that I want to highlight when we think about a registrar who might be struggling in whatever way is the so-called clinical and educational parallels. And what that means is, in very much the same way as we assess a patient, we can identify risk factors, we can prevent and screen for, we can identify, we can investigate, we can diagnose, we can manage educationally the registrar. And thinking about those as sort of almost parallel approaches clinically and educationally, I think is a really nice way of defining what we do when we're in our sort of supervisory educational role. So we're really focusing very much on the top part of that and not talking more about the management and follow-up. And in fact, we'll start with risk factors and etiology, just like you might say, here's a patient with prostate cancer. What might have predisposed that patient to having this condition? Well, obviously, in the same way, educationally, there's lots and lots of things that can predispose a registrar to run into problems.
I actually think sometimes the registrars that are quite part-time struggle in a way, because usually they're very part-time because they're trying to juggle either other work or more likely children. And they don't necessarily get that same intense, like they have all the workshops initially, but then what I find is over time they're not getting the same input, I guess. So unless they've got their own structure for a lot of learning at home, I notice that you do notice that they kind of fall a little bit on the struggling side, probably from just too many balls in the air. But I have noticed that with the very part-time registrars.
That's a really interesting observation, Ryan, because it's kind of a bit paradoxical, isn't it? You might think part-time means they're not as busy and stressed and, they've got time the rest of the week. But you're right, often it's mothers balancing young families or people trying to squeeze too many other jobs, or so somebody's written, family issues, previous training background, past experiences in the hospital or clinic, negative feedback and rotations. Yep, that's all good. And of course, just like with any risk factor, it doesn't mean there's going to be a problem. And lots of people run into a problem without the risk factors. So it doesn't mean we have to be particularly worried. But these things can sometimes help. A bit like Aisha, is there other things in her background that might have tweaked that she was in trouble earlier than we worked out? It's cultural background, Cynthia. Thank you so much. I think that's a really, really valid one. Health issues, isolation from usual supports. Yeah, so they're all great. And it is a long list, and of course, not one we can kind of keep in the front of our mind. This is a really great resource. It's HETI, which is the pre-vocational organisation that supports the education and training of our hospital doctors. But it's actually really good, and not being critical that HETI wouldn't have a good resource, but it's actually very relevant to primary care and to GP registrars. So, and it's freely available. So have a look. It's nicely laid out, and look at that big long list. So there's no way I'm trying to go through that. But it's a nice schema of health issues that might be kind of in the background, and they include alcohol, substance use, burnout. So those sorts of issues, just that they're not brilliant as clinicians, so maybe poor knowledge or skills or communication, those sorts of things. They may be behaviourally challenged. Is that I don't know if that's a PC type expression, but that there are some issues around either being self-critical or lacking confidence, or indeed being prickly or difficult. And there's lots of environmental things in that context about where they are and maybe and how that fits with where themselves with your practice or other people in that. And what I think is really good as part of that is the third dot point under work is transitions. And of course, one of the really challenging periods that we've already alluded to is this transition to general practice. So registrars often do come a cropper early on in general practice. By no means that's exclusive. You will see registrars struggle as they approach exams or, for a significant life event or whatever else. But this is a really sort of critical period. And there's all these issues, as you know, any one of those kind of challenges might be enough to really rattle somebody. But when they're all on day one, which they are, it can be enough to really throw someone. And, in a sense, certainly we're not only talking about this transition, but if there's one thing we can do that will really make a huge difference is that's just be available. And people talk about this more, but just ask, just engage, make sure people are okay. And of course, you're probably thinking, why is there a picture of a swamp there? I think a lot of people now know of Louise Stone and she's an academic GP from Canberra, and she talks about us being swamp warriors. And I love that expression. I think it's very, very reflective of what we do. And this sense of us sort of in the muck, this murky, kind of chaotic, difficult environment that we work in, compared to our specialists who are looking down on us from their hard ground, and it's all nice and sort of neat. This is our environment, and that's really hard for new registrars often, or indeed people may manage for a while and then something else precipitates them not managing so well. So uncertainty is such a challenging aspect. And just on that, there's a couple of really nice papers. This is about as recent as one could hope to refer to in a webinar like this. This was published just last month in AJGP by Michael Tran and Sean Prentice. Sean's done quite a bit of work with us actually in wellbeing stuff. This was a really nice paper, 3 or 4 pages, incredibly accessible, and some nice strategies around this transition into first GPT terms. So that's a really nice paper. Similarly, a few years now since Duncan Howard published this, and this talked very much about your experience and my experience, and so many registrars' experiences of feeling overwhelmed and that weight of responsibility, just how different an environment it was, that independence and that sense of being alone. And again, for us who've been around for a while, it's a nice reminder of how genuinely challenging and overwhelming it can be for new registrars. So clearly this is the transition stuff, but I think for many of us who take GPT-1s, it's a really important time to go, is my registrar okay? There's things that can make it more likely, predispose a registrar to struggling, and some of those background things. I want to talk about prevention and screening, just as we would in general practice with clinical patients. What preventative activities can we do to avoid bowel cancer? What screening tests or approaches can we use to avoid bowel cancer? What preventative and screening activities do we use in general practice to try to minimise the risk of a registrar getting into trouble? I don't want to speak out of turn, but I think there's a bit of an assumption that you'll get to know people or it'll come out, but yeah, this sense of who are you? What are you doing here? How do you feel about it all? What's your background? What floats your boat? Absolutely. And there's nothing more powerful than that. Regular wellbeing checks, said you thank you. Yeah. And I just, again, don't think that happens. I mean, I think it's such an easy thing to just genuinely say, this is a wellbeing check. This is about you and how you're going, rather than, even formative assessment, feedback about performance, being present, concerned. Yep. Anyone else? What other preventative screening can we do?
I find the small group teaching sessions with registrars, because we usually have more than one registrar, very helpful, especially not just the cases they bring, but more so the cases other registrars bring. And then I often get them to, okay, so what would you do? What would you do? And seeing how they think clinically about something just suddenly presented to them.
Yep.
I find I feel like that's quite a good gauge of what's going on for them clinically.
That's great too. Yeah, so we're talking a lot about wellbeing and how they're going, but of course they are seeing patients and they've got to be able to manage it clinically, and that's going to precipitate wellbeing issues if they're struggling. So knowing that they're doing those things well is good. Thanks, Rowan. We often have that bit of a mantra that the registrars that we don't hear from, we should be more worried about than the ones that we hear from all the time. So, as I predicted, none of this really is particularly new, but worth sort of just checking over. And I think most of your contributions were cover the sort of ground I have put up. So, screening tools, to highlight the fact that it can be so valuable and yet sometimes just doesn't quite happen. The RACGP now obviously implement an EASL, an early assessment of safety and learning, that looks at at least a snapshot of some sort of clinical assessment. And so that can be useful if you think, oh my goodness, this registrar has really struggled. And early formative assessments, sitting indirect observation, DO, random case analysis, and multi-source feedback. Those sorts of tools can really give a sense of how the registrar is going. Clearly, there's going to be a lot of very informal conversations, and the receptions feeding back and those sorts of things. We'll get a good sense of how a registrar is going. And you've probably seen my frazzled rooster scale by now. It's been discussed certainly over the last year or so. To me, this is, I think, for those of you who haven't seen it, this has been stolen from the internet. It certainly isn't a highly validated tool, as you can imagine. But we've used it, this very tool, with registrars at orientation prior to commencement of GPT-1. And we've asked them to say, where do you sit? And just again, David, as you say, to ask people, it's a great conversation starter because people, I don't know, there's a bit more of a sense of saying, you know, I'm a number 5. I feel incredibly sort of rattled and frazzled, and that's me right there. What's going on for you? What are you worried about? Oh, you know, missing things and uncertainty, the rest of it. And then it's really nice to implement something similar a few weeks later, and, you know, the cohort's moved down to a much calmer number 1 or 2. These screening tools you probably haven't come across. You might have, and if you've got any experience of them, I'm curious. Or if you do anything differently, please speak up. There is a research tool called the Physician's Reaction to Uncertainty Scale. It's sort of freely available if you Google that. I have never seen it used in educational practice, but it's certainly been used a lot in research practice. And it asks some really very insightful questions around, and it's not specific to GP trainees, but around doctors' response to uncertainty. And I mean, I have toyed with trying to think about this being part of the orientation program for registrars because, you know, somebody scores really, really high on this scale, saying they're really intolerant. I think it is a really important flag to say they might really struggle. And the second two, again, I've just come across it. They exist. There are resilience scales, and there's this alexithymia scale around how sort of impactful stress is on people. Partly, I'm quite passionate about this, and I don't think we do enough in this regard. And implementing a scale about uncertainty, which we know is the big thing, and somebody scoring really high, and I guess we have a sense of it, but we can be really quite. It can really change the way we perhaps act. The primary preventative stuff, and again, I'm so sorry for the RACG centricity of this, and I wasn't able to speak to Akram, which I plan to do, but there are pre-GPT-1 modules on the RACGP at least, that there is an expectation registrars will do prior to commencement. And of course, doing something rigorous and that's going to help their orientation, it is of value. Obviously, none of them do it, but there's nothing to stop you saying these things exist or some equivalent, and go and read about dealing with Medicare and how to bill and managing patients with dependence on addictive drugs, and those sorts of things can, again, help them, make them less likely to struggle early in the piece. Somebody mentioned orientation, so good orientation is, makes a huge difference. Again, we're really focusing on the transition, but I think this is such a critical period. A teaching plan, some kind of a supervision plan about, when to call for help and how to call for help, and the approach to teaching and ad hoc supervision and the rest of it. I think that can really be a kind of a good framework and yardstick for a registrar to feel a bit more comfortable in those early weeks. And of course, Jared Ingham's call for help list, which I think, again, is pretty well known now. If it's not something you're using, I think it's a really, really nice tool. It's long, but it's very highly validated, and it is something you can work through, or allow the registrar even to work through, and they can feel this sense of validation that I've been instructed to seek assistance in these areas where I really don't feel comfortable. And I'll be running a kind of commencement of the new term webinar, and we'll be working through the survival kit, which again some of you may have seen or heard about, and it uses some items, a bit like the contestants on a loan, to select their own survival items to help support the new registrar in practice. All right, so go back to our clinical and educational parallels. Now we're at the early identification. So this is where the patient's symptomatic, unfortunately. So obviously with our bowel cancer example, we would get them to eat a good diet. We'd screen them using an FOBT, but now they're presented with their PR bleeding, or I guess I was about to say weight loss, but that's probably not so early. And the equivalent being educational identification. How does the registrar in difficulty present? Up till now, these registrars have maybe been flying under the radar, or in fact, there's not much to see. So how does the registrar in difficulty present? What's been your experience in practice?
I actually usually find the first thing is they just become much quieter. Even like, incidental conversation or in the tea room or in teaching. That's what I notice first, because there's a lot going on in their head. And so I think there's kind of often a bit of a shutdown relationally, or being forthcoming in teaching. That's what I've noticed as the first sign mostly.
Again, Ruan, really insightful, because that's pretty subtle, isn't it? It might be something you could quite easily just overlook, not notice. Thank you. Other things? What else do people observe in registrars who might be sort of early in their struggles? Vishesh has written running late, not checking the holding file. Yeah, so if you have an opportunity to do an inbox review, or, they're away for a day or two and you're looking at their results and you think, my goodness, what's going on here? Lots of unchecked results, or just left in the, maybe checked but left, and they're not actioning them. Yeah, obviously formal or informal feedback from the rest of the staff.
I often find that they start over-investigating. And so that's where the inbox review is really useful. That also comes out of, where they've come from. Our ACRM registrars tend to come to us with an AST already. And as you were saying, Melissa, if that was in paediatrics, then that they're going to have problems with all of the other stuff around it. Some of them come with 4 years of obstetrics before they've decided to jump ship. And so using investigations rather than being confident in their thinking and how they can think through the problem. But it also means that they're more inclined to order a test than to talk to their supervisor, and that's a bit of a red flag as well, or an orange flag anyway.
Yeah, James Brown's, he talks about why registrars seek assistance. It's a really lovely model, and talks about there's 3 reasons. One is they want you to save them, as in they're just genuinely drowning, and often that's the GPT one who's no clue, and that's completely okay. There's the ones who just want some reassurance, and Aisha, our fictional registrar, in fact, I wasn't going to say, but I will say, who was created by ChatGPT about 3 minutes before this webinar. My goodness, it's it's amazing what it can do. It's sort of frightening. Anyway, ChatGPT put her together, and her prickly behaviour with staff, might be that she's got a personality disorder, or she's just being difficult. But in fact, as was the case with me when I was an early registrar struggling with anxiety, there was a perception from at least a couple of people that I was a bit arrogant. And it was like, well, no, it was actually the opposite. I was just so sort of out of my depth that I think I just came across in not a great way. So obviously behavioural type things as well. But if I was in a room with you, I'd give you a bit of paper and a pen each, and I'd say, draw the registrar and difficulty. This is a really nice little activity to use with registrars or supervisors or medical educators. And when we've done this in the past, one of the really striking things is that people draw a completely normal looking registrar and say, there they are. And that's because they often look pretty normal, and there's not a whole lot to see. One of the, I did this actually online once. There's some images. So now, if I was clever enough, I would have remembered. Anyone wants to interpret? So one eye. So I don't think I was around when this activity happened. Carrying a whole bunch of stuff. Sort of looks like stormy clouds. I'm not sure. Whoever did them would have probably spoken to them. But I did actually do this activity once when we were doing a Zoom meeting, and somebody they didn't draw the registrar and difficulty, but they made it out of Play-Doh, which it happened to be by their computer, and this was it. And in fact, there you go. You can see the slide, and I just thought it was so wonderful. And I don't know whether they smunched the person down so that they were in this sort of fetal position or it just fell off the keyboard, but I thought that was a pretty accurate representation of somebody who's really struggling. And of course, we're not talking about the early identification at that point. That looks like somebody who's in absolute crisis. Again, going to the HETI guide, this is a bit like common presentations or presentations of somebody with lupus or HIV or COVID. I don't know. There's lots of them. But again, nice to sort of categorise them. So aspects of their work, that they're late or not turning up, or they're not seeking advice, or they're seeking too much advice, perhaps. There's sort of behavioural things that we've talked about. The withdrawal is really a good one. Health issues. So again, worth, I think, having a look at that HETI guide as kind of a guide to some of these things. So in educational parlance, there's this really nice, I remember hearing it for the first time and thought, that's such a nice way of putting it, and it's about diagnosing the learner. And so often we've got the registrar who looks like the blue Play-Doh, sort of hunched over, looking not great, and you're thinking, well, what is it? Is it alcohol? Is it depression? Is it just that they're overwhelmed? Is there a health issue? Is it exam coming up? Is it dislocation from family and friends? Is it a combination of all these things? I mean, it's a very, very broad range of possibilities that may lead to a similar presentation. And often we do need to do investigations, just like we would do with somebody who's got dyspnea or abdominal swelling. We have to run some tests. Obviously, and as we've talked about, probably the best one is to say what's going on for you. But what else could we do? What other investigations have we got up our sleeve as supervisors? Or as educators, I guess, because you might be starting to be talking to the registrar's medical educator or to the college, or getting a sense of what else you could do. They're quiet and they're not really engaging as much, and obviously you can have a bit of a yarn and say, is everything going on for you? Is everything all right? I mean, that is an investigation of sorts, but it still might not turn it up. What other things can we do?
I think the sit-in assessments and the random case analysis is helpful.
Yeah.
They're mandatory anyway, but I find them helpful.
Yep. Thank you, Rowan. Yeah, so, there's another poor pussycat with its head in a box. As I say, I really do love, my cats are sort of crawling around under my feet, so I'm a cat lover, but I think some of these are quite funny. Yeah, so absolutely. Now, these are clearly going to detect clinical gaps, reasoning issues, communication problems perhaps, all of which might have a cause that is, health related or substance abuse or overwhelm or whatever. But I think it's almost sort of making sure that there's not a patient safety issue, I think, is important, and that the registrar's functioning, and certainly if they're not functioning or there's significant problems, it really does raise the stakes in terms of what you might need to do. So sitting in RCA, you can, I'm always talking about role plays, so do some role plays and things. Complaints, I think, getting a sense of what those complaints are about, and obviously sometimes a more formal 360-degree appraisal is useful. At lower stakes, I guess, is handover, educational handover from supervisor to supervisor, and that just doesn't happen nearly as effectively as it might because of, I think, privacy issues and concern about sharing information that's pejorative. Whereas you're right, I think it does potentially lead to patient safety problems.
It's just the difficulty of being frank about people. If it turns out that there's a complaint and been involved in, some quite problematic complaints, the patient solicitors are basically saying, why didn't you tell somebody? And the doctor's solicitors are saying, why did you tell somebody? And you just end up caught in the middle of that situation. So I think, having an informal network where you can at least get an idea of what to look for. And so asking questions of your colleagues about, are there particular things I should be looking for with this registrar, as opposed to, do you think this registrar's got a problem?
Yeah. And it's also a really challenging area. I don't know if anyone wants to speak to this or had the experience of separating out the supervisor educational support role from our clinical pastoral care, caring role. And, there have been many times as an educator, I've gone down that road to a degree, starting to think, what's going on here? Are they depressed or anxious, or they're neurodiverse and they've got an ADHD background, and then starting to ask questions and think, oh, hang on, that's not my role. And so, this can be tricky when we're wanting to support a registrar in difficulty where we're worried about health issues and we start to take on a role that isn't really appropriate. I don't know if anyone's had an experience in that regard.
I think it's a very real thing, and I think you have to actually confront that issue as a supervisor, because there is a tendency, we're trained as GPs, we're trained to look for solutions. Somebody comes to us with difficulty, we want to help them, we want to sort them out. At what stage do we transition from that person to the person who says, well, no, I'm a practice owner, is this person okay here? And then what do I have to do about it? And it sometimes does require a shift in mindset.
Yeah. Coming back to our case, so Aisha, I think the point of this case really was, even though it was concocted by AI, I think it wasn't a bad one. I mean, obviously it's nice being fictional, because what it does was, I think, illustrated this one aspect of training, which was the transition into general practice, a high-risk time for many registrars. Much of the potential warning signs can be easily overlooked or explained away by, well, that's what it's like for, maybe a new registrar from a different cultural background relocated to a rural area. It's kind of, that's what I would imagine, but missing maybe some of those warning signs of somebody really struggling with anxiety. And we've heard some interesting sort of context, David. I like that idea of somebody who's spent, who worked in an environment that's all about defining certainty and risk, and then suddenly having to accept that that's just not possible. And so, again, we can create whatever endpoint for that case study because it's not real anyway. But you'd like to think, using some of the things we've talked about, understanding what those risks might be, getting a sense of how the registrar is presenting, exploring some of those issues, being upfront. And I think saying things like, are there any health issues for you? You don't have to tell me, I'm not your doctor, but, is there anything that might be contributing to how you're traveling? Certainly any, life stuff that you need some help or support with, as you know, the management of uncertainty and supporting registrars to manage uncertainty it's not just something, just get on with it and you'll cope one day. There's lots and lots of really good practical strategies that we can support as I rush on. But so back to the swamp, but we've got our guide. Now, this is very much, over the course of training, but a new registrar might really benefit from some of these tips early on. And Jared Ingham, again, wrote a paper, again, quite recently on the so-called 3Rs approach to uncertainty, which is in the HGP and a nice little paper. So there's some particular resources around that. So part of this, the paper I referred to by Michael Tran was part of a series on doctors' health and wellbeing. And I just thought there's a couple of nice papers there, self-care, why it matters and what to do about it, and just the importance of making sure registrars know that they need to look after themselves. I saw this meme recently, and it's funny because it's true. This is how I spend my day now with my cats. But sorry, just to finish the cat theme. So the archaeologist I wanted to be and the one I am now, digging through the kitty litter. So apologies for anyone who really doesn't like cats. But I just wanted to say thank you very sincerely for the work you do in supporting the future generation of GPs and RGs in this country. It is extraordinary, and so much of it is under-recognised, although hopefully by GPSA we do try to recognise it. So thank you for coming. See you later. Thanks all. Bye-bye.
Thanks for watching. We'd love your feedback. Please comment or subscribe to our YouTube channel for updates on new videos. If you'd like to ask a question or suggest a topic, you can contact us via our website at gpsa.org.au. GP Supervision Australia is supported by funding from the Australian Government under the Australian General Practice Training Program.